Hello, everyone. Bonjour tout le monde. I am delighted to provide some brief remarks ahead of the CASN Council meeting. I'm very sorry that I'm not there with all of you in person. At the time of this meeting, I believe I will be up in Northern Ontario without access to Wi-Fi. Otherwise, I could do this live, but really grateful to CASN for facilitating this recording in advance. It's always a wonderful opportunity to get together with colleagues, faculty members, deans, directors from across the country. And so I hope that you are enjoying this time to come together and to learn from one another. So I just thought I would say a couple of things that are sort of top of mind for me when it comes to some of the trends and priorities that we're seeing when it comes to nursing education across the country. So for one, you likely saw the Caring for Canadians report that we released in January of this year. And that actually received a lot of media attention in the Globe and Mail and other fora. And it's a great example of sort of how we were able to integrate some of the modeling into our sort of supply of healthcare professionals across 5 key regulated health professions, including all 4 categories of nursing. And we did that work with Stats Canada and some modeling folks within Health Canada, who are able to look at demographic projections and sort of see whether we're meeting the needs of Canadians into the future with the number of regulated health care providers that we're producing year over year. So have a look at that. The other thing I thought I would draw attention to is the ethical recruitment framework, which we just released in the summer and are now going to be disseminating that. But that's a really important document. Of course, we abide by the WHO code, global code for ethical recruitment as a member state in the World Health Organization. The Canadian ethical recruitment framework is a Canadianized version. I often joke that we sort of poured maple syrup over it and made it our own, but really mindful of the uniqueness of Canada as a federation, and that we are also a destination country, fortunately, for many internationally educated health professionals. But there are some nuances and uniquenesses to Canada when it comes to ethical recruitment. So that's another great document for your reference. And of course, I can't go a single session without mentioning the Nursing Retention Toolkit. But I thought I would mention it from a sort of different perspective in that, I've talked about it previously as an important resource for all of you to use, perhaps as a teaching tool, but also thinking about some of the themes that we identify in the toolkit as things that could be integrated perhaps into curricula and within nursing education. So for example, we know that there's a really pressing problems around violence in the work environment. And so the need to really embed resilience, de-escalation training, mental health and wellness supports into nursing education is really quite relevant, I think, in today's context because of the workforce challenges that we are facing. As well, inspired leadership. All of you, I think, are probably very keenly aware that you are the first role models for nurses in nursing education programs. And so really thinking about how we're inspiring our future generation of regulated health professionals. And then the notion of flexibility. So we talked about flexible and balanced ways of working, which isn't really, it's not just about flexible staffing and scheduling. It actually is about other resources. And I know there's many schools that have really become attuned to the need to actually have primary care supports and mental health supports for students, but also to think about how we can be flexible when it comes to nursing education delivery while still ensuring that students are meeting the required competencies and the terminal outcomes of the program, but really embedding flexibility. And one of the, I think, key pieces around flexibility is the growing popularity for sort of asynchronous learn where you live programming when it comes to nursing education or professional development. So thinking about ways that we can integrate technology. I know there's schools that are doing all kinds of cool things with VR and robotics and all kinds of really interesting things. And so I think lastly, I would just say that I want to thank all of you for your ongoing efforts to ensure that we are delivering quality nursing education in Canada. You are all sort of the barometer for what's happening within the health system and that interface between education and service delivery. And I really am grateful to CASN as well for their leadership in this regard. So I hope you have a wonderful meeting. I hope to see you all in June at the CASN conference, if not sooner. And please reach out anytime. I'm always keen to connect with students and faculty. So thank you very much. Merci beaucoup. Have a great couple of days.